So let's work on putting a full mouth series together. So these x-rays I have currently, these radiographs, these actually are color-coded. This is something that we use in class. In the first half of the class, we color-code them to simplify it. Of course, red are bite wings, yellow are posterior, and blue are anterior. Once our students move into the second half, we get rid of these borders, and the borders are all the same. So, but in the beginning, of course, when we are first learning, all of these x-rays might look the same. So, when you're putting a full mouth series together, typically a full mouth series consists of 14 to 18 total x-rays. So we have our 4 bite wing x-rays. Then, of course, we have our 6 anterior, and then we have our 8 posterior. So let's try and put this together for us. So we want to start with the bite wing x-rays. Typically, if you're putting together the bite wing x-rays, and when you're working on a full mouth series, it all depends on how your brain is processing what is going on with what teeth are making the most sense in your mind. So you don't necessarily have to start with the bite wings, but usually it's easier. I myself, I typically like to start with the canines, just because the canines, to me, I like to kind of set it up that way. So what I'm looking for here is I'm looking for the teeth. And I'll go over this a little bit more once I get this kind of in place. So I'm just separating them now by maxillary, mandibular, and then I'll get into some landmarks and some tips and tricks to show you what's going on. Okay, so what I did was I started placing these out. And what I'm looking for on the maxillary, I'm looking for landmarks on all my x-rays. Anatomical landmarks that kind of tell me, is this maxillary, is this mandibular? Then you can start to process it from there. So I can see on these x-rays the sinuses. That's what I'm looking for on my maxillary posterior in the molar region. Next, what I'm looking for is, how can I determine which one's which? Well, as you learn, the molars are the posterior, most posterior, then the premolars, then we get into the canine, the lateral, and the central. And every quadrant's the same. So I like to work off of that. So in this case, I have my molars, number 1's broken, 2, 3. Then I have 2, 3, 4, 5. I have my premolars here. Now, if these were reversed, you still want to use that same technique. So in this case, I would say, okay, well, these are my molars, but wait, these are premolars, and these are molars. I can tell by the roots. So that's how I know how that one goes. Next, if I go to my maxillary left, I look at, once again, how much of the premolars I can see versus the molar. And once again, we have a broken third molar here. So in this case, I'm going to switch these. Then I want to come to my bite wing x-rays. I can see premolars, molars only. There's that broken guy. So I know I can start to piece together what is going on based on if they have restorations or broken teeth. So in this case, there's that broken tooth. So that's how I know automatically this is the most posterior. And of course, then we have our premolars. Okay, so we want to flip these around. Let's come to the mandibular here. Once again, we have a broken third. Now, of course, we have a premolar, so we know that this is our most posterior. Then we're moving this towards the anterior, so there's our posterior. Next, once again, there's that broken guy, and we have a premolar. So you can start to see the premolar here, but you see more of a premolar on this side. So that's how we know these x-rays are correct. Now, let's get into our anterior. So I like the canines, like I said earlier, because the canines are the longest teeth in the mouth. So I'm automatically looking for those longest teeth. Then I set them up based on the curvature and also the teeth. So I have my canine, then I have my premolar, then my lateral, I have my centrals, then once again, same teeth, but I'm working back in the quadrant. So I have my central, my lateral, my canine, my premolar, molar. So that is how I typically put my full mouth series together. Also, I'm looking at the angulation of the canine. So let's say that you were still in the early stages and you still didn't understand that. I'm looking at the angle my canines get. So if I did flip these x-rays, the canines would be going out, and that's not what we want. We want the canines going in. So we want to follow the curve of Spee with all these x-rays, which is the direction that the teeth are going. So there's our mandibulars. So same thing. We have our canine and our premolar, our lateral, and our central. Over here, canine, premolar. So once again, if we switch those, look at the order of the teeth. That's what you want to try and understand when putting this full mouth series together. So we hope this helps. Certainly feel free to ask any questions, send us any contents, ideas you might have, or something you'd like to see coming up, and we will certainly be working on more information for you. You can find us on all social media, content, and platforms. Just search Cornerstone Dental Assistant Academy or Dental Assistant Nerds Podcast. Until next time, thank you.